Good afternoon, dear patients. Today we will discuss a case involving spots on the buttocks. A 52-year-old man came to us who, as he associates it with visiting a public restroom, began to develop spots on his buttocks. He had never suffered from any skin diseases before, nor had his relatives. So, accordingly, he came in thinking it was some kind of fungus or another contagious disease. Gradually, these spots increased in size, became scaly, and accordingly began to cover and slowly spread to the lower back. He had visited a dermatovenerologic dispensary at the onset of these spots. He was prescribed a hormonal ointment, told that it was an allergy, and basically that was the end of his appointment with the dermatologist. Well, first of all, during the examination, what immediately stood out was the thick layering of scales. A scraping was performed and the psoriatic triad was identified. What the psoriatic triad is, you can watch in a separate video about the symptoms of psoriasis where we explain it in more detail. And well, the man wanted it, so of course scrapings were taken for fungus since he specifically came for that and insisted on it. However, basically, after a negative test result for fungus, the diagnosis of psoriasis was made. Psoriasis can indeed start on any area of the skin. It can appear from the age of 2 or 3, even from birth, and up to over 80 years old. So there is nothing surprising about this. About 2 to 3% of the population suffer from it. And accordingly, it can have a completely different course at different times and can even start on the buttocks, as in our case. He was prescribed the classic Hungarian regimen, sodium thiosulfate, calcium gluconate, and other medications. These are injections and accordingly vitamins taken orally. You can watch a separate video on our channel about psoriasis treatment for more details. This means that not only contagious diseases exist in general, and indeed it is necessary to do tests, but in some cases a simple examination is enough, although this is not as common as it was in our case. And when psoriasis is just beginning, of course, not all the classic symptoms are present, and in some cases it is truly impossible to diagnose it at the very first signs of the disease.